What is a lazy eye? Has your doctor told you you have a lazy eye and nothing can be done about it? Now, again, that depends. If you have been diagnosed with lazy eye under the age of 8 years, it is definitely treatable. However, if you have this lazy eye at the age of 40, and the reason is because you have not been diagnosed before. Lazy eye always happens in childhood. You need to correct the factor which is causing the lazy eye. Now, just like if you don't use your right hand all your life, your right hand is bound to become lazy. It will never get up and do what it's supposed to do. Just like that, your eye, if it is not being used to see, for some reason, it will not see all its life. Now, why is that and why does that happen? Now, you have probably an undiagnosed condition for vision loss in that eye, like a refractive error. The most common cause is a refractive error in one eye and not in the other eye. And you have never gone for an eye checkup all your life in your childhood. So what happens is, when your doctor finally realizes your number is high in one eye and you don't even have a number in the other eye, you have already developed a lazy eye in that eye. Now, if you are a child, and especially if you're less than 8 years of age, this is treatable. What you need to do is treat that eye, give that glass correction, and patch the other eye for 6 hours a day for about 3 months. So in this way, you're utilizing the eye which was not being used all this while. And that's how we get rid of the laziness. It is also possible that you develop lazy eye because of strabismus or squint, in which case your eye is deviated so it is not able to see normally like your other eye. Sometimes the squint can be so minimal that only your doctor will be able to identify it. It is also possible that some children develop cataracts inside their eye at a very young age, and that's why that eye has not been used. You need to get that cataract surgery done as quickly as possible so that once that is corrected, the lazy eye also goes. Now, normally when we say a person has a lazy eye, he does not have any pathology in the eye. The eye is lazy because it's functionally lazy. Otherwise, it has full potential for 100% vision. So just imagine a lazy eye was something which could have been corrected, and you have not shown your children to a retina specialist, to a pediatric ophthalmologist, right in the beginning to check for glasses, and that is the reason why they can't see. So I would suggest that every parent checks the vision, the eyes of their child right from age 1 onwards. Every year, a child requires an eye checkup to rule out conditions like lazy eye.